हेलो आपका स्वागत है दिल्ली नॉलेज ट्रैक में. आई एम डॉक्टर विष्णु प्रसाद पी. आई एम currently doing my internship in AIIMS Delhi. I secured rank 2 in PG entrance conducted by AIIMS in November 2017. एंड अभी आज मैं आपको बताने वाला हूँ कि आपको PG एंट्रेंस के लिए कैसे तैयारी करना है. मैंने अपना तैयारी थर्ड ईयर से शुरू किया था. आई joined a foundation course in there are two major coaching institute in India, DAMS and Bhatia. I joined Bhatia's coaching for the foundation course, which basically includes they teach subjects of the final year in 2 years, that is the pre-final and the final years. And during that foundation course, I basically attended the classes and made notes of all the classes, and then used the same notes for revision. And then बाद में in the internship I joined test and discussion course, which basically involves you go for the class. There's a class for one subject per week, in which they conduct a test for the initial 1 hour of the class, and you're supposed to write the test, and then the rest around 7 to 8 hours we will spend for discussion of the same question paper. So that's how I went as far as coaching is concerned. And then I also subscribe to the online test series. There are many online test series available online, of which DAMS and Bhatia are the best. तो मैंने ऐसे किया था कि मैंने पहले अपने इंटर्नशिप जनवरी में शुरू हुआ था in 2017. So I started with I used to give one test per month, one grand test per month. Grand test means it involves it's just a model test which involves 200 questions which should be solved in 3 hours, just like the original entrance exam. So initially in the starting I used to give one test per month in the January, February, March and all. And after the initial 6 months I gradually increased the frequency to one test per 2 weeks, and then I used to do one test per week also. So that's how I managed. Many of you would be thinking of how to do a revision in internship. My internship it's for total of 12 months. So I divided my time in such a way that I could revise the whole of MBBS in 7 to 8 months initially. That's for one revision. And then second revision I did it in 2 months, and then a third revision which I finished in around 2 weeks just prior to the exam. During my MBBS I went with standard books only. Like starting in the first year, there are 3 subjects: anatomy, physiology and biochemistry. Anatomy, of course, everyone reads BD Chaurasya and then refers to Gray's anatomy for some particular topics. And for physio, Ganong is the standard book, and for biochem, Harper's is the standard book. So and for second year subjects, pathology, Robbins is that's what everyone follows, and pharmacology, KDT, and microbiology and Narayan, and Chatterjee for parasitology, and for forensic I read Parikh's book. And then in final year subjects, medicine, I read Harrison. It's a good book. Harrison is the gold standard, but Davidson is also equally good. And for surgery, Bailey is the best. And for other subjects like Obs and Gynae, I read Dr. J.B. Sharma's book, and Shaw's for gynecology. And for pediatrics, O.P. Guy's book. And for other subjects, CCM, Parks is the gold standard. And for ophthalmology, Dr. Kurana's book. And for orthopedics, I referred Dr. Maheshwari's book. And for anesthesiology, Dr. Ajay Yadav's. So what I mean to say is that during my MBBS, I read only standard books. Many people commit the mistake that they read review books during their MBBS itself. I think that's not very good, because during your MBBS you basically have to build your concepts. Your concepts should be strong, which you can't get from most of the review books. So you have to read standard books during your MBBS, And for revision which you do after passing out final professional exam, during an internship, you can read review books. That's what I would suggest. Nowadays, technology is fast advancing. So, I used many online stuff and many apps for my preparation. I had joined Dr. Bhatia's Institute for test and discussion course, which also included the online test series and as well as an app, in which we can also do online test series. So I basically subscribed to that online test series and did the grand test and subject-wise test as I told before. And I also subscribe to some of the Facebook groups which are run by many eminent faculties. They keep on posting questions, important questions and revision points just prior to the exam. I used to spend around 1 to 2 hours daily, going through those FB discussion groups, which I found very useful because many students post difficult questions in that group. So you get exposure to many questions as well as the revision points help you a lot in doing what I call micro revisions in between, which is very useful. Which was actually an essential part of my preparation. And I also used Dr. Bhatia's app, which in which I used to do the test, online test in the app itself. And what I used to do was that I used to save those the answer keys in that in my mobile phone itself, and I used to whatever free time I got, like going to the ward or sitting in the OPD, I used to just look through those answer keys so that in this way I could utilize my time the most. AIIMS basically conducts entrance for PG courses twice a year. That is there's one batch which starts in January and the other batch starts in July. So there are two exams in a year, which is conducted usually in the first week of November for the January course, and in the first week of May for the June, the course which starts in June. It's the registration for all the exams conducted by AIIMS is through online. They have an online registration platform. They usually starts the registration around 2 months prior to the date of the exam. It's starts in March, by the end of March for the May exam, and by the end of September for the November exam. So you basically have to fill out the forms which is given online, and then upload your photograph, your signature, and then your left thumb impression. Those are the three things that you need to upload. And then your registration, and you'll have to fill out all other details like internship details, your registration, MCA registration number, etc. And then the registration will be complete. And then just around 3 to 4 weeks before the exam, you get a confirmation whether your application has been accepted or been rejected, and if it's been rejected, what is the what was the reason for rejection and how to rectify that. And then around 2 weeks prior to the exam, you get an hall ticket. You have to take the printout of the hall ticket while going to the exam, and also you have to carry an identity card which you had mentioned while filling out the application form, as well as a passport size photo. These are the things which you require while going to the exam. And the exam is it's a computer based test, and it involves the whole exam has 200 questions which you have to complete in 3 hours, which is conducted throughout various centers all over India. I think coaching was an integral part of my preparation because the MBBS syllabus as you all know is very vast. I mean, you can't study the whole thing after passing out MBBS. People prepare for 1 or 2 years, and it's not easy to study all those stuff, revise all those stuff. You need some help which the coaching classes provide. And as I said, there are two major coaching institutes in India, NAMS and Bhatia. Both are equally good. You can join any one of those classes and then attend. They basically, the advantage of attending the coaching is that they basically discuss, the things that are more important. As I said, you can't study the whole of MBBS, so you have to give stress to some important topics. and that's how the coaching helps. And also they give you good question papers which has been prepared by eminent faculties based on questions that were asked recently, which is and this thing is very important for exam, because in exams conducted by AIIMS, there's a pattern that there are a few hot topics from which the questions are asked very frequently. So you have to concentrate on that hot topics and do more questions on that stuff and get your concepts right on that stuff. That is very important. So I would suggest you all to join the coaching for your preparation. Basically, my strategy was to attend all the lectures. Most of the lectures, maximum lectures possible, and then attend all the clinical postings. In MBBS, unless you attend clinical postings, the things which you study won't stay in your mind. If you read a book and then see the same findings in a patient, with your own eyes, then it will stay in your memory for longer. On the other hand, if you just sit in your room and just study the books, it won't last for long. You tend to forget in around in 6 months or something. You will understand this thing when when you pass out MBBS, and then just after around 6 to 12 months after you pass out MBBS, you realize that only things that you have seen with your own eyes during your clinical postings, only those things will remain in your mind. Most of the things which you had studied from the books will not last long. So my advice would be to during your MBBS, attend all the lectures and all the clinical postings very well. That's very important. Okay, so thank you. Please don't forget to subscribe to the channel, Delhi Knowledge Track. Like and subscribe.